And welcome back to Show Me St. Louis. January is Cervical Cancer Awareness Month, a dedicated time to promote prevention through the HPV vaccination and regular cervical cancer screenings. So this morning, Dr. Lindsay Kuroki is joining us live with steps for prevention and what to know. Thank you so much for joining us today.
Thanks, Mary. It's a pleasure.
Okay, so first let's start with what is cervical cancer and who really is at risk?
Yeah, cervical cancer is when these abnormal cells start getting exposed to persistent HPV at the cervix. And the cervix is at the lowest portion of the uterus. With this chronic exposure, there's DNA changes, and that leads to cancer.
Okay, and when it comes to who is at risk, who is at risk, and are there screening options?
So I think the most important question to ask right now is, are you up to date on your screening? And have you ever been screened? Because to be fair, the blanket catch statement is that the people who are getting missed are the ones that are the highest risk.
Okay.
But we know there are other risk factors. So patients who are smoking cigarettes, those that are immunocompromised, either because of medications or transplant or HIV. But like really at the heart of it, we need to provide access so patients can get screened. And it's those who are missed or can't get to the follow-up after an abnormal screen are the ones that we really see getting diagnosed.
So screening is important. And is there a take-home option? I know there's some sort of there's something new that people can do.
Yeah, and you know, medicine is an exciting time right now, but there is an at-home teal wand that has been FDA approved since May.
Wow.
And patients are allowed with a prescription to get a kit delivered to their home. In a comfortable place, they can, in their privacy of any location, can insert the wand in the vagina. It collects a swab, and then that kit can be sealed, delivered, packaged with instructions, and then delivered back to Teal Health. We at WashU were so fortunate, and we wanted to thank all of the participants who actually participated in the validation study for this approval. So St. Louis has helped to make this progress happen. And so it's a way that we need to acknowledge that access is the problem. We need to be able to implement these really accurate screening tests so that patients are getting screened and then the appropriate follow-up, which is the most important.
Well, and that's what I love about that too, is it's just making sure that more and more people are getting the screenings that they need. Now, when it comes to the HPV vaccine, of course, that's a big part of this conversation. Is that effective? Is it effective for both men and women?
Yeah. Very highly effective, 99% effective. And really, though, it needs to be given to individuals prior to exposure to HPV. So the FDA has approved it actually from ages 9 to 26. Older individuals up to 47 can have that conversation with their provider, but the peak time, the way we know the immune system is best primed, is 11 to 12 years old, both girls and boys.
Okay, interesting. So definitely with the younger people is when that's going to work best. Are there any additional steps that people can take for prevention, doctor?
I always encourage the conversation to happen, whether that is at work, at home, among friends. I think we just need to promote and support each other more, but have the conversation with their provider to just start talking about these questions of how do I promote my health. January is Cervical Cancer Prevention Awareness Month, and we have a great screening test. We have a highly effective vaccine to prevent cervical cancer. And now we just need to get it out, spread the word, talk to people, and I thank you for hosting us because this is such an amazing opportunity to reach beyond the walls of our hospital. We need to be in the communities. We know that, and I just hope that people hear that today.
Well, I know that I certainly heard it, and I hope that all of them did because you were so informative, and just your enthusiasm for this was infectious. So thank you so much for sharing this and this passion to keep us all safe. Siteman Cancer Center, of course, you can also visit yourdiseaserisk.com. You can make an appointment via website or give them a call. You can learn more at kck.com/showme. We'll be right back.